everyone. This is Donna Nauman, nurse practitioner. Today I am here with Leah. Leah has been one of my favorite lab representatives, and today she's going to bring us a wealth of knowledge about heart testing or heart testing labs. So Leah, tell us a little bit about like the labs that you are accustomed to working with.
So the labs that I traditionally have done aren't the ones that when you walk into your regular primary care physician that are generally offered. So they're more kind of like out of the box type of test.
Yeah.
That maybe your traditional physician doesn't really know about, but yet they can help prevent disease.
Nice. So when I met Leah, I was doing the standard lipid profile, which would give you like the triglycerides, the LDL, the HDL, and some extra little tests, but that's about all, right?
Yeah, yeah, exactly.
Then you brought this form in that had like, I don't know.
Tests, and I tried not to overwhelm her too much because there is a lot of information, and Donna knows you're always learning. There's always things you can find out. But I wanted to kind of ask her, I posed the question to her, hey, Donna, like I know you're doing all these tests and that's what the guidelines say, but are you still having events, heart attacks and strokes and such in your practice? And she was like, yeah, I am. And I was like, well, did you ever think about maybe why that could be? There could be something else besides just these traditional tests that we're doing. Trying to get her to think outside of the box a little bit and really get her brain working because she loves that. I know. And so she was like, you know what, that you're right. I am doing the best I can for my patients. That's always what I want to do. And anything I can do to help them and help them live longer, happier lives, I want to do it for them. So she just kept asking me questions and, this went on for a while. And I talked about the LDLP and your HDLP, which those are the actual particles that float around in your blood, which, like I said earlier, your traditional doctor doesn't generally talk about because they don't really know about it, to be honest. And it's unfortunate.
I never had any idea until you came in the office and really started talking about it. So kind of just to clarify that a little bit, when patients get their LDL cholesterol checked at the office, that is a number that reflects all of the LDL particles. Is that correct? The highs and the lows?
Oh, the LDLP?
No, it's just a plain LDL. So when they come to the office, they get a lipid panel, and that LDL is just kind of all of the LDL. And when we use your testing, we are getting something different.
Yeah, you're just getting you're getting a bigger picture. So say it's kind of like we have a bunch of cars on the highway, right?
Yeah.
And the more you have, so basically if the little particles are smaller, we're going to get a backup. We're going to get a traffic jam. But if you get bigger, like fluffier ones as they called, there's more room to navigate through there. So, and then they also don't get stuck in that. There's little divots in your endothelium wall where your blood vessel is, and those little particles can get stuck and then they can pile up. And that's when sometimes what happens with the event. So if you get them large and fluffy, big ones, which you would think you wouldn't want big, but you want big fluffy ones, they can't get stuck.
So we're speaking, just to kind of really clarify it a little bit, we're speaking about an LDL, which you typically do get checked at your doctor's office.
An LDL-C.
This test subdivides that LDL into small and big, right? Particles. So it's particles that are different. And the problem is these little bitty ones can kind of like get in the wound. Or like if you are starting to develop heart disease, those little bitty ones can get in the wound and the big ones just kind of bounce off and don't have a lot of damage. Yeah. So I thought that was very fascinating how you have gone through that and help providers. So give us some other ideas about what else comes on that test.
So a lot of times there's one that's called an Lp(a), and that is more of a hereditary thing. You either have it or you don't. You're born with it. And a lot of times for women, if they have that, that's where you see events happening when women go through menopause. So when estrogen levels drop, it rises and you don't want it to rise.
Yeah. So there's other things that come on that test. It subdivides APOA and APOB. Can you speak to that a little bit and what the APOA and Bs are?
Well, you mean like?
So the APOA is less atherogenic and the APOB is more atherogenic. And in the measurements in these particular labs that you do, they give you information about whether or not you have the inflammatory markers.
Yeah, and basically what it boils down to, kind of in anything, the more information you have, the more you're going to be able to deal and treat something. So this is just giving a lot more information than what you're traditionally going to get.
Yeah.
With your traditional.
Would you say that this is probably more of a preventive medicine type of thing than a treatment protocol?
It could be both. It depends, because sometimes, inflammation is very important too. So if your inflammation markers are up really high, and then say your LDLP and your HDLP, they're also high, we have to treat quicker. There's more, and there's just a bigger need. Now, say your inflammation is low and
Sorry, let me get plugged in here. Sorry.
No, you're fine. Your HDL and LDLP are high. You just have more time to treat the patient. So sometimes diet and exercise can work. But as I mentioned, the LP(a), that's hereditary. Diet and exercise will not, it just won't. Sometimes you have to do medication for that one. But a lot of times, really, your big thing is it's diet, exercise, diet. So if you exercise 45 minutes a day, and that could just be, just walking, like a brisk walking. Say you're walking your dog, but you cannot stop. It has to be continuous. That brings inflammation down about 70%. And it comes back every single day. Wow. So that's why exercise is important. And I don't think people realize that, inflammation, you can bring it down, but it comes back within a 24-hour period.
Yeah, I'm a big fan of exercise. I think exercise, it lowers your blood sugars, lowers your risk for infections, lowers your COVID risk, helps your heart. It strengthens the vessels. It's just, everything about it is just a good idea. One of the things
we all try. I know we all try and we all are busy, but that's that, get up 45 minutes early or stay up 45 minutes later. And it doesn't have to be strenuous. And I know it's like here in St. Louis, it's cold outside. So no one wants to go outside. Just even walk around your house or sit on your back and, run your legs back and forth I know that sounds silly, but you could do that even while you're watching a show, but it has to be continuous. It doesn't have to be vigorous. We all can do it. Or even some of those people get an exercise bike can just do their hands. I mean, we all could do something. I mean, you don't tell the dentist you're not going to brush your teeth every day, do you?
No, I like chair dancing too. Like get the music on and just like sit in the chair and go on and do it.
But anything you could do to better yourself, we all strive for that, right?
Mm-hmm. We sure do. One of the things that probably the biggest thing that you said that just kind of caught me was the buy-in to what's the percentage of people that actually have heart disease that don't know they have heart disease?
50%.
Yeah. When I heard that, I was just like, oh my gosh. So I started checking my smokers. I started checking people with high blood pressure. I started doing, they're called Cleveland Heart Labs. It's a pretty big comprehensive panel. It also looks at insulin levels and whether or not you have some kind of leaky gut thing going on just by these biomarkers that are actually on the testing. And so hearing that we're missing 50% of the people it's not uncommon. I mean, I have patients that come in that have a heart attack and haven't a clue, and they're young, they have, they have a few risk factors, but nothing that you would go, oh, they're going to have a heart attack. You think of heart attack, you think of these people that, are obese and diabetic and blood pressure out of control, but there's people just running around with blood pressure with heart disease that don't even know it.
Yeah, I mean, you always need to make sure you check your family history, all those things. So just because you seem healthy just someone looks healthy doesn't necessarily mean they are.
It's kind of like stress, right? On the outside, we all look
Stress
so
is not
good.
good either. That increases inflammation as well. So we all try to get that down as well.
Yeah. Are there some inflammatory marker blood tests that come along with the workup for heart disease?
I mean, some of the inflammatory markers, I mean, that I'm trying to even think back on some of those that were like important. The bigger ones they're ones that you like that you like.
Yeah, I do.
Fibrinogen, galactin.
Yeah. So the fibrinogen kind of tells you clotting factors and what your risk factors are for clogging up your arteries, basically. And then you have the homocysteine levels in the cardio CRP, which are kind of like a little more specific for inflammation. Those two tests I would have done just on a regular basis, the homocysteine and the cardio CRP, because they really give you a good look into your inflammatory, like what's going on with the inflammation inside your body. And it could be anything, like it can be rheumatoid arthritis, it could be heart disease, it can be coming from something else, but knowing those numbers is so important, because inflammation is the lead into cancer. It's the lead into heart disease. It's a lead into almost every disease known to man. And we kind of ignore those markers because they don't have a study or a drug for them that make them appropriate to use.
Yeah. What are your thoughts on the Lp(PLA2, that biomarker? So that one's used primarily in prevention setting as a predictor of cardiovascular risk in patients with no prior history.
Yeah.
So that's a big thing that a lot of people don't know about.
Who wouldn't want to know that?
Yeah, exactly. I mean, you could really dive deep if someone's, has a history and concern. I mean, to me, a lot of times, like, why does it hurt to do these tests and to know? Because knowledge is power, right?
Yeah.
And that's the way I always looked at it. And I always had physicians say, like, I'm so happy that we know about these. I feel like it's really helped a lot of patients. And me, when I'm doing the job, it just it made you feel better.
Yeah, it does. And then, like when they come back, I would sit down with patients and go over all of them with them. And it's just so fascinating. Like I had a patient that I just loved, and he had already had heart disease, and we drew the Cleveland Heart Labs on him. And despite the fact that he was on a ton of cholesterol medicine and he was on, all kinds of high blood pressure, like if you looked at him, he looked awesome. Like he was not overweight. He was, he was happy. He didn't have any stress in his life. And that's kind of hard to find these days. Yeah. And he ended up having an event, and it just broke my heart. But at that point, he was on a lot of the standard of care medications. And so, the question is then, if you're on the standard of care medications and you do those testings, what can you do to, improve from there? And so that test also has fish oil levels and whether or not you do well with aspirin. So it kind of gives you these other kinds of information as well that could actually help prevent a disease or heart event.
Yeah. And there are some too on there, can tell, so certain people that are on statins, there's a certain percentage of the population that you could be on a statin and it's just not working for you because your body absorbs it differently, and that you have to add an extra medication on in order to actually work. And I am actually one, because I did get all these tests.
You what?
I actually am one of those people that statin would not work for me.
I had those
tests without an added. Yeah. So there's just a lot of things you can learn. I mean, vitamin D levels are huge. I don't think people put enough emphasis on that either, because some people come in and they're like, I'm so tired all the time and stuff. And then you check their vitamin D, it's so low.
I know.
That has a lot to do with.
I had a patient that came in, and she had respiratory infections 3 to 4 times a year. And we started her on the vitamin D that I carried at the office, and she went 2 full years without any respiratory things at all. She actually did a video with me. She's like, that stuff works. I'm like, yay. I wanted to kind of back up to the cholesterol medicine
Okay.
and how the cholesterol medicine really works. And
Yep.
also kind of add in there, one of the other tests that comes with that Cleveland, if you order it, is the CoQ10 level. And I know CoQ10 is one of those things that when you're taking Lipitor, it can reduce your CoQ10 levels. And so CoQ10 is important for the body. And so knowing if you actually have the CoQ10 is important, because people that take cholesterol medicine and get that aching and pain all over have a real problem with CoQ10. And so in the big scheme of things, if you knew that up front, you would start somebody on CoQ10 for a couple of weeks before you actually started them on the cholesterol medicine so that they could tolerate the medication better.
Yeah, and I think that was one of the big pushbacks, like sometimes people get, because not most are covered, some are not. But I mean, there I am. Sorry. Most of the tests are covered, but not all of them are. Some of them are cash pay, and they might be like $10, $20, and that can add up. But when you think about the cost of the medication, those all add up too. So if you're putting everything up front, we're putting on you the right thing and not changing you 4 or 5 times. So you're not going back to the pharmacy 2, 3, 4 times. And hopefully if we get it right, you don't even have to be on any of these.
Yeah. Yeah. I mean, I think we really need to be looking at our body as a temple. And like, if this guy here is supposed to last to 80 or 90 years old, how do I get to be 80 or 90 and not be, bed bound, wheelchair bound in a nursing home? Because that is the last place that I want to be.
Me either.
Yeah. So I think like that's part of why I want to bring all this information to patients and to the general public, is because like there is so much more we can do. You have to ask your doctor for the Cleveland Heart Labs. He won't run them. I can just tell you that. The place that we did at the office, we used Health Lab, and Health Lab, the patients that got them done through Health Lab, I think it ran somewhere between $50 and $60. So it was actually a pretty inexpensive when it ran through the Health Lab.
Yeah. And I think it's just about knowing and wanting to know, and going out and finding that physician that you can partner with and you guys work well together and they're willing to listen to you.
Yeah, I agree. And, the other thing is a lot of the doctors that were not doing conferences, during all the COVID and stuff. And the last they used to do free conferences for us to go to, and we would learn a lot of stuff from those conferences, and they don't have them anymore. But this is more really on the side of functional medicine, a side of medicine that is really more intrigued with prevention and wellness. The study part that we use to put people on medication is very different than the approach of doing prevention. So
yeah, I think the functional medicine, in my eyes and how I've always looked at it, they look at what's inside and they want to fix what's inside. So if you fix the inside, that fixes the outside, right? So they don't want to just put a Band-Aid on something and just, here's a Band-Aid, here you go. They want to dig deeper and find out the root of the problem. And if we can find out the root of the problem, it's funny how it like spirals and fixes everything else.
Yeah. Yeah. Do you have any examples of any cases or anything that any doctors ever kind of shared with you?
I mean, not off the top of my head. I know one of our medical science people, her husband was having a lot of back pain and all this stuff. And it came to find out he worked in like the oil field or something, I think is what it was. And he was exposed to heavy metals, which a lot of people don't talk about those either. Yeah. And he went to a functional doctor, and I think it was in Kansas area maybe. And they ran all these tests, and he had all sorts of problems. And he was on pain medication and heart medication and all these things. Well, eventually what happened, he got all these tests, found out that he had heavy metals in his system, his particles were high, like there was a bunch of different things. Yeah. And they fixed all that, and he's fine. And he also wasn't able to sleep a lot too, so he was having insomnia as well. And when he got all these tests and then started, they did have to start him on medications and stuff, and then weaned him off, and doing great.
Yeah, isn't that weird? Like, I don't know. Like, I think there's probably a lot of people running around with diseases out there that could be better served doing diet, exercise, nutrition, looking at a Nutri-Eval or looking at a Cleveland Heart Lab or doing some of these different types of lab to try to isolate it. It's a very difficult process because as a functional medicine provider, you have to be very knowledgeable about a pretty broad amount of things. I mean,
the whole body.
Yeah, immune system, toxicities, cardiovascular, endo, you know, hormones, and oh, it just goes on and on and on.
Just go on.
Well,
I hope it helped a little bit.
Yeah, I'm so happy that you could come today and just kind of help tell people a little bit about the labs and the benefits. Like that's the big thing here, is helping people realize that, as you said, a lot of people are going undiagnosed with heart disease or have plaquing that's fairly far along. I don't, you know, my husband was just telling me the other day about somebody who, no symptoms at all, and then all of a sudden was having like open heart surgery with, you know,
all time.
3 or 4 vessels. I'm like, oh, you know,
hopefully it helps, and hopefully someone listens or it sparked to something to ask a question, because, you know, always ask questions. I tell everyone, always ask questions, and you have to fight for yourself.
You do. I like 100%. We need to learn stuff, and then we need to implement, and we need to be our own advocates. Like nobody's coming to help. We got to do something because healthcare is changing.
It is, and especially nowadays, everything's going somewhat telemedicine or things of that such. So doctors have to really be on their game, because they're not really seeing them in person. So,
yeah. Well, thank you, Leah. That was so awesome. I think it was filled with information. Cleveland Heart Labs is what they're called for the person that's listening. That's like, you know, how do I get that? You'll have to have your provider order it. It's a lab test that you have to have an actual order for. So Cleveland Heart Labs, that's what they are. If you want to do a little prevention, there you go. Thank you, Leah.
Bye.
Bye.